Good afternoon, everyone. This is Wendy Myers. You're just listening to Everyday Animals. That song is called Insane from their new album, Under the Tyranny of Good Weather. It's a fantastic album. Go check it out. This is a Live to 110 podcast. I'm a health and nutrition coach. I started my site, liveto110.com, to educate people about how to get healthy, how to lose weight, treat their health conditions naturally without medication, and how to detox from heavy metals and industrial chemicals that are so prevalent in today's toxic world. And my goal at liveto110.com is to basically help you avoid disease and live a long, healthy life. And, living to 110. So please keep in mind that this program is not intended to diagnose or treat any disease or health condition because that would be illegal. Live to 110 Radio is solely informational in nature. Please consult your healthcare practitioner before engaging in any treatment I suggest on this show. And if you have any comments or questions for our guest today, Leader Chan, about physical therapy, please call in at 917-889-2838. Again, that's 917-889-2838. So pick up that phone and call in. Don't be shy. We want to hear all about your questions if you're in pain, and we can maybe check out your scenario and see what's going on. So don't be shy. Call in. Last week's show was great. I interviewed Evan Brand from NotJustPaleo.com. We shed some light on, basically how important it is to follow in the footsteps of our ancestors by following a paleo diet, and talk a little bit about how to modify the paleo diet, get a little bit more healthy and relevant to today's world. And also we gave you some caveman fitness tips with a few questions about ancestral health and fitness. So definitely check that out if you're wondering what all the fuss is about over the paleo diet. And it was a fantastic show. Next week, I'm interviewing Amal Van Halsema of vhpilates.com. She's a master Pilates instructor whom I've been working with for about 2 years. And she's a fantastic Pilates instructor and really incredibly knowledgeable, so I wanted to interview her and share her knowledge with you. She explores how Pilates improves your body and helps you rehab from injury, and how it tones your body and gives you an amazing body. During the show, we're going to explore the benefits of Pilates, the difference between reformer and mat classes, Pilates for pregnancy and postnatal care, and also how Pilates helps with people that have multiple sclerosis, stenosis, and are rehabbing from injuries. We're also going to talk about how Pilates benefits men, and specifically how it complements cross-training in many sports like golf and equestrian sports, etc. So check out this really fantastic show on Tuesday, April 30th at 2 p.m. So today's show, I'm really excited. I'm going to be interviewing my brilliant physical therapist. How are you, Leader?
Fine. Hello, everybody. It's an honor to be on the show, Wendy. Thanks for inviting me.
Thank you. Yeah, I really wanted to have you on because I just think you have so much knowledge and you're just such an amazing physical therapist. I've worked with a lot of physical therapists, and I just really haven't had the accelerated improvement that I've had when I've been working with you. And
thank you very much.
Yeah, you're welcome. So I really wanted to have you on the show and let everyone know how they can also reduce their pain, because you don't have to walk around in pain and in agony. And so basically, Leader, you work at Orthopedic Physical Therapy and Association in West Los Angeles, and you're a doctor of physical therapy. You have your doctorate from USC, and basically, I found you because I finally succumbed to physical therapy after I had unrelenting back pain following the birth of my child. And I put off getting help because basically I thought that physical therapy was for old or debilitated people. But, I was basically in denial that I actually fell into this category.
Yeah, that's actually a lot of people's thought, to be honest with you. Yeah, it's actually a common misunderstanding to this profession. We will actually talk a little bit more later on. And, I want to actually really introduce what true what physical therapy truly is to our listener, to let them actually get an idea of when and what when they need to see their physical therapist and what the physical therapist can do for them. We can actually talk about that later on as well.
Yeah, because I hate when I see people, I hear about people in pain, or I see some of my friends that are, in a tremendous amount of pain, and they just feel like they just have to deal with it, and they just have to take pain pills to suppress the symptoms. And listeners out there, you don't have to live like that. You can get your body functioning how it was prior to your event or your injury. So that's my message today, is you don't have to live in pain. So, Leader, you work at, right near UCLA. You work at Orthopedic Physical Therapy and Associates in West Los Angeles. Mm-hmm. And, and I hear that you did the USC doctorate program. And I was just wondering, how long did that take, and how was your experience there?
Actually, at the time when I was in USC, they offered different kind of program. I was a physical therapist in Taiwan, actually. Back in 90s, and after I came here, they offer a different program for people who already got their degree in physical therapy, their bachelor degrees in physical therapy, to be continue to actually achieve a better or a higher educational level. So I was in their post-professional Doctor of Physical Therapy program. It's a little bit different than right now they're offering. Right now they actually try to shift the program into what they call entry-level Doctor of Physical Therapy program. So that means that they don't really take physical therapists who's already earned their degree before. They right now want to actually promote physical therapy into the next level to have everybody actually graduate from a doctoral degree.
Oh,
right
good. Mm-hmm. And so how did you turn to physical therapy? Like, what led you down that path?
When I was back in Taiwan, I didn't really know what physical therapy is at the time until I was in the school and I became a volunteer in the hospital. I started to see how physical therapists actually help patients, and I started to get to know what physical therapy is, and I found it actually fascinating at the time when I get more in contact with patients, with therapists actually working with a patient at the time. So I want to be like them. But back in Taiwan in late 90s, we don't really have a lot of advanced knowledge with what the physical therapist should do or should go, or physical therapist profession should go at the time. That's why I decided to actually come to the United States to actually seek for higher degrees of education to try to figure it out. And after I graduate from here, I have the opportunity to actually start to practice here. And I actually loved and I actually fell into love with this environment. So that's why I started my own practice over here and start to help patients over here.
Yeah, Southern California is a nice place to work, huh?
Yeah, it is. It is. Yeah.
And, I have to say, I've worked with a few other physical therapists before being referred to you by a really good friend. And I was really bummed because she actually referred me to you about a year ago. And I just put off going because I just kept thinking that my back pain was going to go away or somehow it's going to get better. And I did see some improvement with these other therapists, but I really improved by leaps and bounds since working with you. Because I've been working with you for about, 7 months or so, and for the first time in years, I'm not in pain all day long with back pain. So what do you think that you do differently than other physical therapists?
Actually, to become a therapist, you actually need to really focus on examination or evaluation part, which is actually sometimes easily forgotten by a lot of therapists. You need to really know what your patient needs to be achieved in the beginning in order to actually to make your treatment program and actually to make it effective. And we all been taught that in school, but as we practice alone for years, some of us actually kind of like forget about how important it is. I have to remind myself constantly as well, because if you don't have a good evaluation of what's going on the patient, it will lead your treatment program to eventually a failure pathway. So you're not going to be able to help your patient if you don't start right.
Well, what I noticed with you is, say, these other therapists I work with, they were spending an entire hour like doing exercises, and maybe occasionally they would do some electrostimulation where they put these little electrodes on your back and stimulate your muscles to relax them. But with you, you actually really get in there and just dig into the body part and like you're manipulating it. And it's actually, a little bit painful, but I think that it's definitely necessary to manipulate the body in a way to get it to change, to change the alignment, whatever. And I didn't have that with other physical therapists. We were just doing exercises. So why is that necessary to do the physical manipulation?
No problem. Let me elaborate on that a little bit. First of all, this actually we need to actually differentiate us with a chiropractor. They use the word manipulation and use adjustment a lot, and I think a lot of the listeners are actually going to get easily confused with us and chiropractors as well. First of all, we don't really use that term a lot, adjustment. We like to use the term mobilization or joint mobility. That's what we care the most. As a physical therapist, we actually we examine body's adaptive dysfunction. That means that when the body's actually having some problem, they actually start to compensate, and they start to develop sort of a series of a dysfunctional adaptation based on what the problem they're having. So when that happens, sometimes muscle get into a very tightness stage, or eventually get into spasm, and the joints are now moving well. It depends upon which part of the joint. It could happen on your shoulder, on your spine, on your knee, on your hip, or even on the ankle, on the wrist. So we like to use techniques that actually help your joint to move. And that's actually very different than chiropractic adjustment. So that's a part that a lot of patients actually will actually be easily confused when we actually reach to the spine, especially your neck or your mid-back, your lower back area, because they hear the popping sounds out, or what we call cavitation. But we're actually not really interested.
I love that sound.
We actually are not interested in that sound. We're actually interested in the mobility or how mobile the joint that we actually create. And that's actually what our treatment goal is, because we need to identify what are the joints that are actually not functioning well, not moving well, and we want to actually specifically treat those joints to actually make those joints to move better, or to actually recover the movement of the joint.
Well, do chiropractors work with the joints? Because I know every time I've gone to the chiropractor, they only do my back. But do they work with like ankle joints and knee joints and things like that?
Yeah, so we're actually doing a lot more than just spine. We move almost every joint you can find in your body. We even move your jaw, the TMJ, the joint over there. We actually move every single joint you can find. So that's actually a lot more than just spine. But I'm using spine as an example because it's actually the easier to hear. So a lot of my patients actually sometimes get excited hearing that, but I need to carefully explain to them that it's not a chiropractic adjustment. So we don't really get into chiropractors' category, because they do their adjustment for some reason. They want to do that in order to enhance the body's function, or some other knowledge-based techniques they're having over there. So that's actually the most important thing I need to actually have our listener or my patient to actually know when I treat them in the beginning. Yeah.
Mm-hmm. So can you tell listeners out there what exactly is physical therapy?
Yeah, that's actually a very big topic, but I can actually give a better idea in a very like a very easy way. Physical therapy is actually or physical therapists is actually they're like teachers to actually help you to move well, to actually retrieve your function or your healthy or your healthy way to move your body. And with physical therapy, we don't use medication. We use a variety of physical therapy agents or modalities to achieve the goal in the beginning. We use menu therapy. That means we use hands-on work to work on the patient, like I said before, to help the joints or to help the joints to move, to calm down the tension on the muscle, or to actually help the inflammation to go away from a certain area when you're having it. And then physical therapists will actually make up exercise programs specific, customized for a certain specific situation to help the patient to recover from their injured state, to actually help them to go back to their healthy, functional movement or situation.
Mhm. Yeah, I know my goal is just to be able to go on a 30-minute walk without my back hurting. It's just kind of pathetic, but it's working. It's slowly.
No, yeah, and you actually mentioned a very important thing. We with a physical therapist, we actually need to hear what patient's goal is, because sometimes if you don't understand patient's goal, you might actually you actually might estimate too much or too little for the patient when you want them to reach a certain degree of achievement. Like for you, you want to actually have a 30-minute walk with your dog, and we can actually achieve that based on what you want. But with athletes, we actually need to actually set up a different goal if they want to go back to their sports or their professional performance. So it's very different. That's why I say that the physical therapist, when they actually build up, when they establish the exercise program, it has to be very specific. It has to be customized. So it's not like your gym exercise program that you're exercising in the gym. It's actually specific for your dysfunction or your injury. So that's another part that a lot of the patients that they don't really see or they don't really understand. So whenever their physician asks them to see a physical therapist, they don't really know what's going on over there. So this is actually a great opportunity for me to introduce what we're doing to all the listeners.
Yeah, I had no idea when my OBGYN suggested that I see a physical therapist when my back pain post-pregnancy wasn't relenting. It wasn't going away. I had no idea what it was. And I'm glad that and it took me a couple months to make the call and finally sign up and just walking around needlessly in pain. But I'm really glad that I finally made the call, because, I mean, that was 3 years ago. I worked with a couple of bad therapists before. I didn't make the progress that I had hoped. But it takes some time for the body to change. But I wanted you to tell the listeners what kind of healing techniques are used. Like what kind of, I know you said you do the manipulation, but I want to hear more about electrostimulation and icing and maybe some other techniques you use to assist the people in healing.
Sure. So for physical therapists, we use a variety of techniques. The menu techniques is actually one of them. Is actually just one part of them. We use electric stimulation to actually drop down the inflammation, help the muscle to relax, or even promote the healing process. You can use it on a different kind of a stage. We use ultrasonic treatment, not a diagnostic ultrasonic equipment. We use a therapeutic ultrasonic equipment to actually help to promote a deep layer of a muscle spasm or muscle pain to heal by relaxing them with ultrasonic treatment.
I love the little wand. They put over the muscle. So my muscles are so much better after you use it on me. It's like this deep warmth or something that gets deep into the muscles.
Yes, and some of us, some of us like me, we use taping techniques. There's a variety of taping that you can choose. I'm actually specializing in kinesio taping, and I found that it's actually really fascinating to either reduce the edema for especially pitting edema for my post-operational patients after they actually just finished the surgery. And you can use kinesio tape to reduce muscle spasm or tension, or you can either promote a weak muscle area to actually make it functional better. So that's one of another specialty I'm actually using in my practice. Some of the therapists.
Actually, interesting. That's interesting that taping can help edema and muscle weakness and the spasming.
Yeah, and some of the therapists actually use laser to promote healing, on a certain area. I don't have laser in my practice, but I know that that's a pretty latest technology, and I know that there's a growing amount of therapists actually using laser in their practice to help to promote healing. And I think that's pretty much about the physical therapy modalities we're using normally.
Well, you use traction too, right?
Yeah, we do use mechanical traction, but we use that for a specific purpose. When patients actually having a disc injury or disc situation, depends upon the evaluation process. Traction can be very helpful to actually get rid of disc impingement to the nerve or the pressure to the nerve. It could actually help to regain pretty tremendous amount of the function and reduce a lot of pain. Yeah, so we do use traction.
What is that exactly? Like, what happens? The person lay on the table and they're...
Oh yeah, we basically strap the patient on the table, and we use the mechanical force to actually decompress the area that actually being pinching on the nerve. So by doing that, we can actually shift the pressure from that area to help patient to reduce their to reduce the involvement of a specific pressure to the nerve. So that's exactly how it actually does the work.
So it's like you're pulling their neck. It's like a machine that's pulling their neck.
Yeah, you pull the neck. You can pull the neck, or you can pull the lower back. So it depends upon how you set it up. We can set it up both ways. Either way, not both ways. Either way, yeah.
Okay, and you use icing too, right?
Yeah, we do. Ice, heat. It really depends upon patient's need. We like to use ice in a very acute inflammation, and we use heat as well to actually reduce muscles tension or muscle stress. That way, those are actually part of a combined physical agent we use usually the patient with electric stim. Yeah.
Well, I think a lot of people think they're going to be coming into physical therapy to get a massage, like they're in a spa or something. Do you use massage in physical therapy?
Yes, that's another interesting comment. Yeah, I do have several patients coming, like they're looking for massage place. We do not massage, but we do therapeutic soft tissue work or soft tissue mobilization. The reason why we call it in that specific term is because when we move a certain muscle or ligament or soft tissue area, we're actually doing it for therapeutic purpose. We want to actually heal the muscles interference with that area. It's really not going to be a very nice massage, like a nice, relaxing massage that you're going to expect in the spa. So a lot of patients end up having questions, isn't this to be nice relaxation massage? No, it's actually not. So
when I heard people like some funny noises, like they're screeching and they're
yeah. So when you meet your physical therapist, you're not going to expect a nice relaxation or massage for most of the part. Yeah, they're doing that for therapeutic purpose. Sometimes they need to actually get rid of a lot of muscle tension you're having or a lot of scar tissue formation you're having. So they're actually breaking down those patterns. That's actually involved with some pain because they're stretching the pain fiber as well. So in that area,
Yeah, tell me about it. Well, I've been coming to see you for about 6 months with all kinds of injuries, namely, both my wrists were hurting from doing too much yoga. I'd sprained both of them, and then even after they weren't hurting anymore, you continue to adjust them. So why is this necessary exactly?
Okay, so first of all, we want the joints to be moving in a certain way that we like it to be. We don't want any restriction with joints motion. But however, when you actually accumulate your injury or your dysfunctional condition for a certain time, I'll say that after about 3 to 4 months, your body starts to adapt the changes. So it's going to be hard to actually correct your body's doing. So when we're doing, especially when you actually carrying those chronic situation, we have to educate your body to move in the right way. But sometimes we can achieve it with only one visit or only one treatment. So sometimes it's necessary for us to continue to correct the way that your body moves. So,
is that because your body kind of wants to go back to the old holding pattern, like the old alignment that was just
exactly.
small?
Yeah. So once we achieve that, usually we'll follow with exercise to try to get you out of that cycle because we don't want to have you to stay in that cycle forever. So that's actually that's actually a very important part of a physical therapy. We want to educate our patient, get rid of the cycle, especially the pain cycle they're actually getting involved with. That way they don't have to see us forever. Yeah.
Okay. Yeah. So it's also important to not think that you're going to be able to go in there and get a quick fix at a physical therapist. That it takes time for the body to change. It takes time for the body to realign, and it takes time to teach the body to stay in that proper alignment. So you're looking at some time to heal your body. It's not going to happen like overnight.
No, it does not. And like I said earlier before, throughout the research, we find that after your body is actually in pain or in dysfunction for about 3 to 4 months, it actually starts to imprint those memories into your movement pattern. So that's why it becomes chronic, because our body just learn from those information. So when we get patients out of those cycles, it does take time because we want body to receive new information to correct their movement pattern, to help them to move in a healthier way again.
Yeah, so like it probably would take 3 or 4 months for the brain to learn the new pattern.
Really depends upon how long you've been suffering. The longer you're suffering, that imprint message actually gets more stubborn. So I'll say that if you're actually acquiring a new injury, it will be a lot faster to take care of it if it's within about 3 months. After it's actually passed about 3 or 4 months mark, it's actually we're going to either spend about twice as longer to really get your body to go, or sometimes even longer than that. If it's actually more than about a year or 2. I do have patients coming to the office when they're suffering with the pain or the same pain pattern for about 2-3 years, and those are the patients that's actually very difficult to pull them out of their pain cycle. So it does involve a lot of work, a lot of time. Those are the patients I always tell them that you're probably going to expect that you're going to stay with us for a longer time, like about 4 or 5 months, in order to actually break out that pattern. Yeah,
and so that reiterates the point that listeners out there, if you're in pain, don't wait to get help. And don't go to your doctor and just accept that he's just going to give you pain medication, because that's only going to make it worse. That it's get in to see someone, a physical therapist, preferably leader if you live in Los Angeles.
Thank you, Wendy.
the longer you wait, the worse it's just going to get, and then the longer it's going to take to heal. So I had another question. Whenever I come into the office, you adjust my back every time. Why exactly is that necessary to adjust my back?
Yeah, once again, it's really involved with how long you've been suffering with that lower back pain, and what kind of injury you actually got originally in the beginning. Like for Wendy's situation, because her joints, a lot of her joints are not actually moving exactly the way that we want it to be. Even though we actually gave her numerous treatments already. So that's why we need to continue to actually give them the right information. But like I said, after we actually give that right information, we want the body to move the way we want. So we usually will accompany with exercise to actually help the body to change. So for Wendy's case, because it's actually been a long time, so it's really hard to have the body to really get the right information for just few times. So that's why we have to continue to give her the treatment in order to help the body to pick the right information. So that's why, Wendy, that's why we need to continue to give you that treatment. But,
I know, I think my spine just wants to keep popping out of alignment. Every week, I come in once a week, and just every week the whole spine adjusts. Like it all kind of cracks, so to speak. I know you probably hate that word, but it like you just have to force it back into alignment, back into the proper alignment.
Yeah, actually the alignment is actually the terminology that chiropractors use a lot in their profession. So we don't really use that word. Like I said in the beginning, we use the word like mobility. Your spine, your joints mobility, individual joints mobility is just really not good. So we have to continue to provide that mobility for you to actually use those joints. Otherwise, you're not going to use it. That's it. Yeah.
And so, what is that technique you use? I was talking to someone. They said that you kind of use an osteopathic technique.
I was actually fortunate enough. I have a continuing education with USC, and they actually have osteopath. The doctor of osteopath actually start to teach us how to mobilize our patient more correctly. So I was fortunate enough I can actually retrieve that training, and I've been using that a lot. We oftentimes, when we mobilize our patient correctly, their body will actually respond to a better way and to heal in a better way. So I'm actually using a lot of that right now.
So what is the difference between the osteopathic technique that you use and the chiropractic technique?
Like I said, we need to actually find a very specific joints. That's what we do a lot, and we don't use a very high velocity force. We use actually more like a gentle, more gentle force, and we like to get the muscle to get involved. So that's actually a huge difference. So even though sometimes you still hear some cavitation or some popping sound, if you will, or cracking, but like I said, we don't really looking for that. We actually look for the joint to actually move in a normal physiological way. Yeah.
Yeah, I noticed definitely after I have you fix my manipulate my back and put it back into the proper mobility. My back's definitely sore the next day. Like the muscles are in a new pattern because they're kind of sore.
Imagine that if we tied up your elbow, your shoulder for quite a long time, and we try to release it, you're going to feel the same amount of soreness. It just that's actually such a tiny. For example, for your case, it's actually a very tiny joint. That's why you don't really feel it in your normal life. But it's actually exactly what you're doing to tie up your joints over there. So when we first release those joints from immobility, it must be soreness actually coming out of that area. Yeah, because you just actually resume the joint circulation, and the joints start to move. So yeah, that's how much it takes. Yeah.
Okay. So I want to revisit the electrostim that you use. I want you to explain exactly what that is and exactly why that you use it. Because I know what it is you take about 4 little pads that transmit the electricity, and you hook them up, to wires to this machine. And I sit there for about 15 minutes while it's kind of contracting and relaxing. And after 15 minutes of that, it feels like you have like an hour massage, like your muscles are totally relaxed. I love it. So why exactly, what purpose does that serve, and why you use it?
We use it for different reasons. In a very acute stage of injury, like when there is a lot of inflammation, we usually use that with ice together. We're hoping to actually use that, the pumping or the whatever you're feeling, you just described, along with ice to really calm down the inflammation in the area. And especially in a really acute swell or inflamed area, and also the numbing effect from the electrostimulation itself will actually help to reduce the pain feeling when patients first come in when they're actually really inflamed. So that's actually a really good tool to use. But later on. In the later on stage, like your stage, when it's actually a chronic muscle tension or a really higher tension, we use that with heat to actually promote, the circulation and to reduce the tension on the muscle, and at the meantime give you a nice, massage feeling. So depends upon each stage. We can use it with a different purpose. That's what I'm trying to say. Yeah.
Okay. And I noticed you had some Pilates equipment in the office, and
yes, I do.
How are Pilates and other exercise techniques used to help patients?
Yeah, Pilates equipment we are having in our office is just one of the many exercise techniques we actually use to help patients, and. Not like Van, which is the guest, who is the guest you're going to invite next week. I'm not a Pilates instructor, so what we're doing is just retrieving some of the Pilates technique or some of the Pilates exercise that's actually suitable for specific need of a patient. We're not going the entire Pilates program in my practice. And we also utilize some other very different exercise technique to help patients. One of our unique technique when we're actually evaluating the patient's need in terms of a therapeutic exercise program is we actually specific target to their long lost function. For example, if an athlete actually comes in with for example, if it's a pitcher from the baseball team, when it comes in with a shoulder issue, we don't really only focus on the shoulder, because sometimes it's not the shoulder that's actually the area that need to be blamed for or need to be actually taking the credit of the dysfunction. We actually search it down to the entire body to actually find that where are the actually associated dysfunction along with the shoulder pain. So sometimes you're going to be amazed to find out a pitcher is actually having an ankle sprain or the ankle injury in the beginning, and he start to actually adjust his pitching posture and start to actually irritate his rotator cuff to actually start to give some inflammation on the rotator cuff tendon and end up with some more further injuries. However, if you actually have that pitcher just work out in the gym to regain shoulder strength, it's really not enough. You actually need to actually carefully examine that particular situation and try to find where's the other source that's actually causing that particular problem. So in this case, this is actually an actual patient we're having. He actually acquired ankle sprain repetitively from other sports. he likes to play soccer as well, and he ended up actually adjusting his own posture while he's pitching, and actually end up giving himself a rotator cuff injury. So one of the beauty of our exercise program is because we need to actually see that, and then we can customize for a patient's different need. And we like to train patients in a very different way than you guys are actually being trained in the gym, because in the gym you're actually more focused on the definition of a muscle. You actually want to look good with the muscle's definition, or you want that muscle to actually show up, to stand out. In our exercise program, we don't really do that. We actually train the muscle to be functioning in the right way with a right strength. So a lot of our exercise, we will not actually specifically train one muscle only. We're actually training different muscle, even different body group or different joints in a systematic way or in an integrative way to have them to function, to maximizing either athlete's performance or to maximizing your strength when you actually need it to recover yourself to a normal physiological movement pattern. So I hope that actually answered your question a little bit better.
Yeah, I have to say I know how that athlete feels with the kind of transference of one injury to another, because I kind of had a similar thing. Is when I'm sitting on my butt writing my blog, my butt hurts, and I would come in to be like, "Leader, my butt is hurting," like the very end of my tailbone, and it really was a muscle in kind of like my lower back that was tight or irritated, causing this transference of pain to like the bottom of my butt. But it's really funny because you think that the pain is being caused exactly from the area from whence it's coming, but it actually can be from another area.
Yeah, exactly. I was using a very extreme case because that was a really fun case we found. But what my point is, sometimes where you have pain is not necessarily where it's actually causing the pain. So that part is actually the value of a physical therapist, because we will be able to try to identify or to at least to find that find the link between those for you to understand your body a little bit better. That way you don't acquire the same kind of injury again. So it's actually the most valuable, standout, position we're actually having.
Well, here's a basic question for you. What exactly causes pain?
Again, that's a very broad question. Yeah, so it really depends upon what kind of pain you're having. First of all, pain is a learning behavior. We don't really actually acquire that when we were first born. Some of the pain signal is actually a learning behavior. So again, it's a really broad topic. So I'm trying to be brief and short. Pain is usually a signal that actually warns your body that actually something's wrong, but they can explain themselves. So when you actually have pain, you probably need to respect that, even though it's actually starting with some minor stuff. So when you actually pay more respect to the pain signal, you're actually going to be able to regain your health a lot faster. So different kind of pain that will lead you to different kind of profession to actually try to get help. But a lot of us, there's a pain signal that actually we forget, or we actually try to not to deal with, and it's pretty often that we do that. It's actually like the nagging, achy pain. Specifically speaking, it could be from the lower back, it could be from the neck, or it could be from any kind of joints that you use a lot, like your shoulder, your elbow. Sometimes when you acquire a nagging, achy pain, you just pop in the pain pills or some anti-inflammatories to actually try to control it. But when you actually accumulate enough change or enough pathological change, it actually become a true damage to the structure. So what I'm trying to say is, when that happens, it's actually harder to treat it. So a very simple rule to respect your pain is actually when you actually have a pain repeatedly and you cannot control that with your pain pill, it comes on again and again. It's actually the time that you seek for professional help. Either you can actually go to your physician or you can go to your physical therapist. Depends upon what kind of a pain you're having. In turn, if it's actually related to any dysfunctional injuries, like posture, like you're now having a good posture, and you know that for sure that the pain actually comes from that, or you require some dysfunctional movement pattern that the pain is actually required from that. You can actually try to seek help from your physical therapist, and I think that's actually a healthier attitude to actually to face the pain. Yeah.
Well, a few clients I've referred to you have waited years to seek treatment and just popped pain pills to get through the day. What are some of the problems with taking pain pills for pain, and how exactly does this worsen someone's condition?
Yeah, as we always actually educate our patients, or as a lot of physicians are educating their patients, that's another big topic of pain. When you pop in a lot of pain pills, you actually raise your threshold to detect the pain, and it's actually become a cycle. It's become a pain cycle. So it's not only masking the symptoms or the original injury you're having, it's also actually making your body, truly does more adaptive changes. So that means that your body is actually going to be more dysfunctional, or the injury you're suffering is actually going to become worse, but you're just actually using those pills to mask the true situation that you're having, and later on it becomes a learning cycle. So you're educating your body to be okay in that kind of way, and it will really deteriorate your body's health and your and not only that, but eventually your mental health as well, because you're actually going to be dependent upon heavier dosage of a pain pill or heavier or stronger kind, which it's really not a really good cycle we want our patient or our listener to stay with.
Yeah, I got stuck in a cycle like that before I got pregnant. I don't know why, I kind of hurt my lower back, and I started taking Vicodin for it because, hey, I was in pain. I need to take a pain pill. And then
exactly.
I slowly learned that because I couldn't feel my back, I would do things that I shouldn't be doing because it would hurt normally, which is basically the signal that my body is giving me to tell me to stop doing this activity and lie down. But I also was injuring my back more and more because I couldn't feel the pain. That is a signal to my body to just shut up and sit down.
Exactly.
And so I was doing that. I would stayed on these pain pills for a little, quite a while before I finally dawned on me, if I don't stop taking them, my back's never going to heal.
Yeah. So that's actually the cycle that we've been talking about. That your body is not moving toward to the healing, is actually moving to a pathological adaptation. So you're actually just dragging yourself away from healing more and more.
Mm-hmm. Yeah.
And not only that, you're actually giving your physician or your therapist a big headache if you continue to do that, because there will be very few things they can do for you, but keep increasing your pain medication volume, or give you a stronger kind of a pain medication until it fails, and it's really not a good pathway to stay on.
Well, when I was first injured, I injured my back about 6 weeks after I had my baby. I started working out, thinking I could just work out like I used to, even though I hadn't worked out for like 9 months. I did not want to see a physical therapist because, I thought it was for elderly people who were out of shape, and that wasn't me. So I postponed treatment for months until I just couldn't take my back pain anymore. What can happen if you wait too long when you're in pain to see a physical therapist or other healing practitioner?
No problem. Yeah, like I said, it could actually go into that kind of pain cycle we were just talking about. And yeah, to correct that, I think a lot of the patients, when they're actually hesitating to see a therapist, yeah, that's actually one of their many thoughts. They just think that therapists are actually for elderly patient to go to actually to work with or to actually teach them how to exercise or to walk. But actually, to actually answer your question a little bit better, physical therapists actually see a really variety of kind of patients. Our patient age group actually starting from infants to all the way to about 90, 95 years old. I actually have a 93-year-old actually in our practice, and I have a list as little as about 4-year-old in my practice as well. So if you really wait for too long, you're actually unavoidably you're going to set yourself into that kind of a pain cycle. It's actually an endless cycle. It's never you're never going to get a chance to come out of that cycle, and you depend upon on your pain medication forever, which is really not a good thing to do.
Yeah, and a lot of people do that. They just wait a long time. And for instance, I have referred a few patients to come into your office they're just in so much pain that you couldn't even touch them. So what may someone have to do before you're able to treat them if they're in so much pain that you're not able to give them more mobility or manipulate their back?
This is a part that we need to coordinate well with pain management physicians. If the patient's inflammation or pain is actually really outrageous, and we can't really we can't really control or contain it from our treatment. Oftentimes, we need to actually get help from the pain management physician. They can actually help patient to do more stuff in terms of their injections or their other kind of approach to help to shut that cycle down in a more aggressive way. And in that time, I'll either actually refer the patient out to a proper physician or to actually consult with their referring physicians to see if we can actually get together to actually offer more aggressive help, not just actually from a physical therapy point of view, but to actually get some other professionals' opinion and idea to help the patient in a better way.
So those injections that you talked about, those are for I'm assuming to reduce inflammation that's causing the pain.
Reduce inflammation, reduce the pain to get rid of that pain cycle we were just talking about, that like popping the pain pills and waited to subside it and the pain started again. They oftentimes the pain management physician they could actually do aggressive approach to really shut that cycle down for the patient to start physical therapy. That way, patient actually get greater result, and they don't have to wait for a long time for those situations to shut down.
Okay. So how long after an injury should you see a physical therapist? Because some people think they should wait, like it should heal for a few days first and then see someone.
Depends upon every individual situation. But you can see a therapist as soon as you think you get the injury. So we oftentimes will give you a better idea of what kind of injury you might have and what the healing time is and how long you need to see us. So I'll say that you can actually do that as soon as possible. Yeah.
So right after the injury, you can.
Yeah, right after the injury. Yeah.
Okay. And so I understand that all the top neurosurgeons in Los Angeles refer their patients to you. How exactly do you help patients with neurological problems?
I'm actually we see a lot of thoracic outlet syndrome patients, abbreviation TOS. They're actually a very unique group. That's one of the neurological problems we're seeing in our practice. So again, I think the most valuable things we're doing in our practice, actually, we identified where the dysfunction is. We're not trying to identify the pathological changes. We're actually identifying the dysfunction. And with that kind of approach, is actually better. Is actually more acceptable for those kind of a patient to take. So so especially with thoracic outlet syndrome, those patient group, because they're oftentimes actually in chronic pain, and not only that, it's actually a very very broad area. It actually has a lot of different kind of situation ongoing. So a proper evaluation and examination to actually determine what a patient truly needs is actually very important to start the patient's care, and that's what we actually doing the best.
I guess what I'm getting at is that I think you're so good at what you do that I have a friend of mine that comes and see you, and not only can you manipulate people physically, work with their muscles and whatnot, but you can also help with neurological conditions, like work with the nerves. Like my friend, she has a problem, like her health condition kind of irritates her ocular nerve. And she says that you are able to calm that down and stop that nerve from irritating her eye. And I think that's where your genius lies, is you're just so knowledgeable at the body, not only the muscles, but the nerves and everything, that you're able to, take care of a lot of health conditions and neurological conditions that a lot of other physical therapists aren't able to touch or even know about.
Yeah. Those are our specialties. But again, we need to carefully consult with their physicians to actually understand what the nature of the problem is, and then we can actually start to take care of the patient. Depends upon what kind of situation they're in. So it's hard to explain really in the details right now, but we do offer that kind of specific treatment for for the nerve situations or nerve problems.
Okay. Yeah, I guess it's kind of hard to explain how you work on nerves.
No, it's just we have a pretty limited time. That should be actually a specific topic that we need to go into in terms of how we actually help patients to get rid of that kind of problem. So that way we can actually get more specific into those conditions. Yeah, because nerve or neurological problems is actually a too broad kind of a topic.
That's a whole other show.
Yeah, it can be breakdown into a variety of situations. Some situations they're really actually going to be beneficial from physical therapy, but some other conditions we when we identify that, we need other professionals to get in to help. So that's why I can't really answer that question in a perfect way.
Okay. Well, Leader, I guess that we're out of time, and I thank you so much. I really wanted to express to people how gifted that you are, that you have so many talents, and you're able to help such a wide variety of health conditions and help people improve them and work in conjunction with their doctors to improve their not only physical problems but neurological problems as well. So I thank you so much for being on the show, and definitely listeners out there, if you live in the Los Angeles area, you're in pain, definitely give Leader a call. Leader, what's your phone number where people can contact you?
Sure. My phone number is 310-209-2011, extension 2. That's my office number.
Okay, great. And thank you so much for being on the show, Leader. And
thank you, Wendy, to invite me to the show. Yeah, you have a nice day.
Thank you so much.
All right.
Okay, bye-bye. So listeners out there, don't forget, next week I'll be interviewing Van Holsema from vhpilates.com. call in and ask a Pilates master how Pilates can help you. So talk to you soon. Thank you for listening. This is Wendy Myers signing off.